About almost 1/3 of the couples that are having trouble conceiving is actually diagnosed with something called unexplained infertility. Having unexplained infertility almost adds a bit of a insult to the injury to these people because all the blood tests come back normal, the semen analysis checks out fine, there are no mechanical obstructions, yet a couple is still struggling to conceive. And they're left feeling kind of powerless, not knowing how to help themselves or where to seek help because there's nothing wrong. Um, I feel like there's no such thing as unexplained infertility. There's only places that we still haven't looked yet. And a human being is more complex than just a snapshot of their body at a particular point of time. So any kind of imbalance or disease is really a hologram of a genetic and environmental, physical, nutritional, emotional, spiritual, and even behavioral aspects. So I always tell people your fertility is not necessarily just confined to your pelvic region, but it really is an expression of your overall health and well-being. If you are one of these people who has been diagnosed with unexplained infertility, there's still places that you can look to find answers. And a lot of these places actually have to do with our lifestyle. I'll list a few big ones for you so that you just kind of get a sense where to look in order to kind of try to peel all these layers while trying to look and answer and to really feel more empowered and to give you some control over the situation. So thing number, a first place I would visit is actually your sleep. Are you getting enough? Are you able to sleep at night? Are you getting only 5 or 6 hours versus 8 to 10 hours? Sleep deprivation is really rampant in the United States, and we know that not having adequate rest can cause things like hormonal issues. It can predispose you to type 2 diabetes or heart disease, and it can really cause many issues in your whole system. So getting adequate rest is really extremely important. Another important aspect is your weight. For fertility purpose, you want to keep your BMI between 20 and 25. Being overweight or underweight is not conducive to getting pregnant. So if you're overweight, sometimes just losing 5% of your body weight can actually increase your chances of getting pregnant by quite a bit. And same goes for if you're underweight. Gaining a little bit of weight can actually help you get pregnant faster. This goes for both partners. Another aspect is exercise. Are you a couch potato or are you a gym rat? It seems like I see a lot of extremes. People are either overdoing it or underdoing it. Neither one is good for our fertility. So if you're someone who doesn't really move your body much at all, then it's time to really get off the couch and start moving. And I think the secret is you actually have to find something that you enjoy so that you can stick to it. Walking, dancing, yoga, whatever it is that sings to your heart, go ahead and do it. But then if you're someone who has been going to the boot camp 5 to 6 times a week, chances are you are overdoing it and you need to tone it down. So really intense exercise, you don't want to do it more than twice a week. More moderate things you can do daily. Caffeine, another big one. People live off of coffee and sugar nowadays. So if you're drinking more than 200 or 300 milligrams and about 1 cup of, an 8-ounce cup of coffee usually contains about 100 milligrams. So if you're doing more than that, you're decreasing your chances of getting pregnant, and you're also decreasing your chances of staying pregnant. There's some studies that show that increased caffeine actually increases your chance of having a miscarriage, unfortunately. Alcohol is another big one. There's some conflicting data to, how much alcohol is actually allowed if you're trying to get pregnant. And some sources show that about more than 4 glasses of alcoholic beverage per week will decrease your chances of pregnancy. It also has a bad effect on the sperm. But the good news is that if you actually abstain from alcohol while you're trying to get pregnant, and the sperm will regenerate in about 3 months of time. Another really obvious one is smoking. Smoking, there's a very strong evidence that it ages our reproductive system in both male and female. So if you're trying to get pregnant, please stop smoking. Sometimes I have couples who are going through IVF. A man is a smoker and their docs say, well, don't worry about it. You don't have to really completely quit because we'll just take the best sperm that we can find and we'll inject it into the egg and all will be good. But that's not true. It's actually, research has shown that even if couples going through IVF, even if ICSI is being used, which means the sperm is being injected directly into the egg, smoking still lowers your chances of successful IVF. So I highly encourage you to ditch the cigarettes if you're trying to get pregnant. So these are just some of the areas. Of course, there's diet and there's many other things that we can look at. It can be kind of overwhelming. But these are some good places to start. And as we go on with these videos, I will add more advice and things that you can be doing to improve your fertility. So thank you so much for watching. I wish you all the best in your journey. Thanks.